Yes, I'm back again. As I said earlier on, I just finished discussing about malaria, and the second topic that is affecting millions and millions of people in Africa, Asia, even the Americas is also typhoid fever. This is an epidemic that affects most people in Nigeria, and it has led to the death of so many millions of people in Africa because it's mostly prevalent in populations that are developing. So we may ask, what is typhoid fever? Typhoid fever is a disease caused by a bacteria known as Salmonella typhi. So typhoid poses a serious threat in developing countries around the world, mostly in parts of Africa, Asia, Pacific, Oceania, and parts of the Americas, as I mentioned earlier on. So typhoid spreads through contaminated food and water or through close contact with an infected person who has infected typhoid fever. Symptoms of typhoid fever. Yes, you have high fever, headache, abdominal pain, constipation, and diarrhea. So how does typhoid fever spread? Listen carefully as I will list out the information on how typhoid fever is spread. The bacteria Salmonella typhi only lives in humans. Persons with typhoid fever carry the bacteria in their bloodstream and intestines, both the large intestines and the small intestines. So persons treated with medications normally recovers from typhoid. But that is not the end. They still carry the bacteria in their body. Ill persons of typhoid also shed the Salmonella typhi bacteria in their stool. So people who have typhoid fever, when they stool, there is still prevalence of typhoid fever in their stool. Yes, you can get typhoid fever by eating food and drinking beverages that have been handled by a person infected with typhoid or Salmonella typhi. It can also be contaminated by drinking water that have been contaminated by the bacteria. This normally occurs when sewage in the environment contaminates the water you use for washing, cooking, and drinking. The gutters or the rivers becomes contaminated. These are some of the steps. So once a person is infected, the bacteria spread rapidly in the carrier's bloodstream and multiplies, thereby causing various symptoms to show face. So, what are the various modes of transmitting Salmonella typhi? One of the ways is drinking contaminated water. Another way is eating fresh fruits and vegetables that have not been properly washed, that are contaminated with the bacteria, or a water that have been contaminated with Salmonella typhi that was used in washing the fruits and vegetables. So it is very important that we remain careful. Or another form is eating food prepared by someone who has not washed his hands thoroughly. So eating seafood harvested from a contaminated body of water like lake, ocean, and river can also lead to someone contaminating the bacteria. The symptoms I mentioned earlier are not all the symptoms that is prevalent in typhoid fever. There are still other common symptoms, and they include constipation, cough, headache, loss of appetite, stomach pains, sore throats, pink spots in the chest and abdomen, diarrhea, bleeding from the rectum. Diagnosis and tests. Diagnosis of typhoid fever always come with blood tests, stool or bone marrow for evidence of infection. So they take your blood or your stool or even parts of your bone marrow for evidence of infection. So what are the treatments and medications for typhoid fever? The most prevalent treatment for typhoid fever is using of antibiotics, and the common drugs of these antibiotics are: 1. Ciprofloxacin. Ciprofloxacin comes in injectables and also comes in tablets. This is one of the common prescribed medication. Then you also have ceftriaxone injections. It doesn't come in form of tablet or medicine, but it comes in form of injections. You also have amoxiclavulanate. You also have pafloxacin, and etc. etc. These are some of the most common medications used in treating typhoid. Other supportive measures to treating typhoid fever and preventing it includes drinking plenty of water to avert or prevent dehydration, which results from prolonged fever. What about prevention? Avoiding typhoid infections, you have to be aware of eating contaminated food and drinking contaminated water. You can also boil your water before drinking it. It is also important that you use disinfectant liquid available in pharmacies, or better still, drink company bottled water. Yes, it is very important for you to use disinfectant liquid. Most pharmacies do have it in form of water guard and the rest. You can use it to treat your water before you drink your water. Another way is by keeping flies away from your food, the food you want to eat. And also cook your food and vegetables thoroughly before eating, and also eat your food served hot. Another way is by you washing your hands regularly due to contamination from touch surfaces, and also wash your fruits properly with vegetables such as salad before eating them or cooking them. Then fresh fruits and vegetables can be contaminated from farm, especially in developing countries where strict measures of hygiene are not followed or incorporated. So following recent research, at present there are vaccinations available that can be used to prevent typhoid for about 3 to 7 years, depending on the vaccine used. The vaccine is available in oral routes or injections, that is in medication, injections and the likes. So your medical doctor will be in the best position to determine what is preferable for you or your children. So these are some of the helpful tips in helping you to prevent typhoid fever and treating typhoid fever. Look forward to further medical examinations that will benefit you in your household and families.